Infection Prevention and Control (IPC) refers to the policies, procedures, and practices used to prevent and control the spread of infections in healthcare settings and the community. It's a critical component of patient safety, public health, and global disease control. Infection Prevention and Control (IPC) is a systematic approach to preventing avoidable infections in healthcare settings, protecting both patients and healthcare workers from harm. It encompasses various strategies and practices aimed at minimizing the risk of healthcare-associated infections (HAs). IPC aims to reduce the risk of these infections. Focus on evidence-based practices. IPC relies on scientific evidence and best practices to develop and implement infection prevention strategies. Comprehensive approach. IPC affects all areas of healthcare, including hand hygiene, surgical site infection prevention, injection safety, antimicrobial resistance, and emergency preparedness. Why is IPC important? Protects patients from acquiring healthcare-associated infections (HICE), protects healthcare workers from exposure to infectious diseases, prevents outbreaks in hospitals and communities, reduces antimicrobial resistance (AMR) by lowering infection rates and reducing the need for antibiotics, saves lives and reduces healthcare costs. Benefits. Effective IPC reduces patient morbidity and mortality, lowers healthcare costs, and enhances public health. Core components of IPC. 1. Hand hygiene. The single most important measure to prevent transmission of infections. When, before, and after touching a patient. Before aseptic procedures. After exposure to bodily fluids. After touching patient surroundings. How? Alcohol-based hand rub ABHR for routine hand antisepsis. Soap and water when hands are visibly soiled. 2. Personal protective equipment (PPE). Barrier protection to reduce exposure to infectious agents. Types. Gloves, masks, surgical N95, gowns. Eye protection. Proper use includes donning and doffing in the correct sequence, disposing of PPE safely, using PPE appropriate to the risk level. 3. Environmental cleaning. Surfaces and equipment must be cleaned and disinfected regularly to minimize contamination. High-touch surfaces, bed rails, doorknobs, light switches. Use effective disinfectants, for example, chlorine-based for some pathogens. Establish cleaning protocols and training for staff. 4. Sterilization and disinfection of instruments. Reusable instruments must be cleaned, disinfected low, intermediate, or high level. Sterilized autoclaving or chemical sterilants. 5. Waste management. Proper segregation and disposal of waste reduce the risk of contamination and injury. Color-coded bins for different types of waste. Red, infectious. Yellow, sharps. Black, general waste. Staff training is essential. 6. Respiratory hygiene and cough etiquette. Promotes practices to reduce respiratory droplet transmission. Cover mouth and nose when coughing, sneezing. Use tissues and dispose of them properly. Wear masks when symptomatic. Maintain distance if unwell. 7. Safe injection practices. Prevents infections like HIV, hepatitis B and C. Use new, sterile needles and syringes for each injection. Avoid multi-dose vials when possible. Proper disposal of sharps and puncture-resistant containers. 8. Surveillance of infections. Ongoing monitoring to detect, report, and respond to infections. Track healthcare-associated infections (HICE). Analyze trends and respond to outbreaks. Use data for improvement. IPC in special settings. Outbreaks and epidemics. Rapid identification of cases. Isolation and cohorting. Contact tracing. Enhanced PPE and hand hygiene. Community education and risk communication. During surgery, use of aseptic techniques. Preoperative antibiotics when indicated. Strict sterility of instruments and environment. Here's a more detailed look at the importance of IPC. 1. Protecting patients from healthcare-associated infections (HAs). HAs, or infections acquired in a healthcare setting, are a significant concern. Effective IPC measures, such as hand hygiene and proper cleaning, can significantly reduce the risk of HAs. By preventing HAs, patients experience fewer complications, shorter hospital stays, and lower healthcare costs. 2. Protecting healthcare workers. Healthcare workers are also at risk of contracting infections while providing care. IPC practices protect them from occupational hazards and help maintain a healthy workforce. This ensures that healthcare facilities have the staff needed to provide quality care, and that they are not at risk of contracting illnesses while on the job. 3. Preventing the spread of antimicrobial resistance. Overuse and misuse of antibiotics can lead to the development and spread of antimicrobial resistant bacteria. IPC measures such as proper hand hygiene and limiting antibiotic prescriptions help to control the spread of resistant organisms. This prevents the development of infections that are difficult or impossible to treat with antibiotics. 4. Improving patient safety. IPC practices contribute to a safer healthcare environment for patients. By reducing the risk of infections, healthcare facilities can improve patient outcomes and overall quality of care. Patient safety is paramount, and IPC measures are essential for achieving this. 5. Improving healthcare quality. Effective IPC programs contribute to the overall quality of healthcare services. By reducing infections and improving patient safety, healthcare facilities can deliver better care and patient experiences. This can lead to increased patient satisfaction and trust in the healthcare system. 6. Reducing healthcare costs. HAs can lead to increased costs associated with longer hospital stays, additional treatments, and complications. By preventing HAs, IPC practices help to reduce healthcare costs. This can free up resources for other important healthcare initiatives. 7. Promoting antimicrobial stewardship. IPC practices, especially proper hand hygiene, help reduce the need for antibiotics. Promoting antimicrobial stewardship. This is crucial for preventing the development of antimicrobial resistance and ensuring that antibiotics remain effective for future use. 8. Supporting research and development. IPC principles are essential for conducting research on infectious diseases and developing new treatments and vaccines. By controlling the spread of infections, researchers can better study the mechanisms of infection and develop effective interventions. 9. Promoting public health. IPC practices in healthcare settings contribute to public health by preventing the spread of infections beyond the healthcare setting. This is important for maintaining community health and preventing outbreaks of infectious diseases. 10. Educating the public and healthcare providers. IPC education is crucial for both the public and healthcare providers to promote good hygiene practices and understand the importance of infection prevention. This helps to create a culture of safety and awareness about the risks of infection.
Subscribe and follow My Health by Dr. J for more health videos.